and she will be talking about the delayed diagnosis and treatment of coccidioidomycosis identified through the enhanced surveillance in Riverside County, California.
Slide advance through that. Of course.
Hi, everyone. Good afternoon. My name is Amanda Mitry. I am from Riverside County Department of Public Health. I will be presenting on behalf of myself and my colleague, Bethan Swift. Our project is focused on delayed diagnosis and treatment of cocci identified through enhanced surveillance, and specifically for Riverside County. This is mostly from a public health perspective, so forgive some of the missing clinical aspects and everything. But I'm really excited to be here and to chat with you. So just to kind of set us up a little bit, this is John, last name Doe. Maybe some of you have met him before, but he is a 49-year-old male who works in the construction industry, spends a lot of time working outside, and digging is a big part of his job. So we start to see that John starts to develop a cough, and a few weeks later, he wakes up short of breath at night. And then since this was pretty much out of the ordinary for our friend John, he made an appointment to see his primary physician. And he was then given antibiotics and was told to recover, that he would recover shortly, and that his symptoms unfortunately ended up continuing and then worsening over the next few weeks. And then we start to see that he lost some weight, he had some muscle and joint pain, and started experiencing some fever and night sweats around this time as well. Then his symptoms continued to worsen, and he was rushed to the emergency room and then spent 3 nights in the ICU, and was eventually diagnosed with cocci and then given antifungals. So thankfully, John, our hypothetical friend, made a full recovery, but unfortunately, the series of events is something pretty common with a lot of our patients. And to get into it a little bit, we know a lot of the background about valley fever, so I'm going to end up skipping a few slides. But we know, again, that the fungus lives in the soil, it grows. We've seen an increase in cases. We see that a lot of it is asymptomatic. And our friend John lives in Riverside County, which is highlighted in red here. It's a pretty big county, pretty long, and it's home to about 2.5 million individuals. It shares a border with LA County, Orange County, San Diego County, San Bernardino County, and Imperial County, and it's also right here next to Arizona. The summers in Riverside County, just to give a little bit of background, they're pretty hot. I know I made this joke earlier, but it's definitely not as hot as here in Arizona. But we do have some highs that reach about 120 degrees Fahrenheit, especially in the Palm Springs area and some of the desert area. We see that the central and eastern regions of the country are predominantly desert, so the parts of the county that do stretch out are of desert weather and desert patterns. And then we've been seeing recently that the county has been experiencing some unusual weather events, such as flash flooding. We saw in August and September in 2023 that the county experienced a lot of flash flooding from tropical Hurricane Hillary. And this combination with heavy rainfall and then the hot and dry summers made it pretty much the perfect environment for our lovely fungus to start to grow. As we've been chatting about for the last couple of days, that the number of cases have been increasing, and we've been seeing an increase in Riverside County as well. So in 2016, we had about 64 confirmed cases, and then it increased to about 417 in 2023. We see that some of the causes of the cases in Riverside aren't really well understood. We see that could be potentially due to a lot of the winter rains after the drought, climate factors such as increases in warmer weather, soil disturbing activities in these endemic areas. Riverside is one of the fastest growing counties in California. I think it's the 4th most populous county in California, and I think the 10th in the US. So a lot of individuals have been moving over there, a lot of new construction, a lot of new homes. And we also know that we've had some increased recognition more recently and reporting as well. And the CSE case definition, the change in 2019, could also help account for this larger jump, but it doesn't increase for a lot of the further increases that we've been seeing as well. So our project came from our unfortunate understanding that there was no active follow-up of valley fever cases in Riverside County. Valley fever is endemic to the Riverside County area, so there's not a lot of active follow-up, and there was really no expectation to do so. This was mostly just due to time, our staff time and prioritizing other diseases. If any of y'all have been watching the news, a lot of things come up, so we end up kind of having to reshuffle a lot of what we do and what we focus on. But given the increase in the number of cases, we started to ask, what is the actual epidemiology of valley fever in Riverside, and is there anything that we can actually do? So we started this project in 2024 to do the enhanced surveillance. We adapted a survey from the California Department of Public Health that asked some questions on demographics, their symptoms, clinical presentations, potential exposures, and also treatment. Our inclusion criteria included a positive lab result for valley fever in 2024. They did have to be a resident of Riverside at the time that the test was done, and they had to be 18 or over, and their address must not be in a correctional facility. And in 2024, we did receive 475 positive valley fever lab reports. And of those 475 positive reports, we saw that 426 met the inclusion criteria. And then we attempted to call all persons who met the inclusion criteria between 2 and 4 weeks after their test was done to administer the survey. If they didn't pick up, we left a voicemail and attempted to call them a couple of times. And just to share a little bit too about the survey, it ended up taking about like 30 to 45 minutes per survey. It was conducted by, we had some individuals that were contact tracers for COVID that we were able to keep full time, and they were assisting with some of these calls. So they were really good at talking to a lot of our community members. We also had the calls translated in Spanish as well as needed. And to share a little bit about the survey results, about 53% agreed to complete the survey, which is really high for, just a random person from the Department of Public Health calling you to ask you some questions about this mystery disease. The completed surveys were pretty representative of all the tests that we saw in 2024. So that included age and sex. There was a slight difference in the region. We saw that there were a lot more survey participants that lived in the northwest region of Riverside, even though we had assumed initially that there would be more individuals in the east side near like Coachella Valley, Palm Springs area, and the drier areas, that we thought that they would have been the ones that were testing positive. Looking a little bit at the demographics, we saw that 57% were men, 43% were women. Their median age was 57 years old, and the range was from 18 to 90 years. And about 51% were of Hispanic or Latinx, followed by about 34% being non-Hispanic white, which is pretty similar to our overall demographics of race ethnicity makeup in Riverside County as a whole. 52% were employed, about 30% were retired. We have a pretty big retiree community that live in Riverside County. We also asked questions about their health insurance and status. 99% of the participants had health insurance, and it's kind of broken down that majority did have private insurance. Some of them had Medi-Cal, which is Medicaid, and then other government insurance. And then we might have been missing just a larger chunk of people who were just not covered under their insurance since it was missing as well. We saw that about 59% of the participants reported having a comorbidity. We see here that about 37% reported having either type 1 or type 2 diabetes, about 18% reported heart disease, and 17% reported asthma. And as we've been kind of chatting a little bit too, that valley fever can be more severe in people with comorbidities, so this was pretty telling with some of what we were looking at as well. When we were thinking about potential exposures, we did ask the question. We saw about 36% of those that were employed worked outdoors. About 52% had jobs that involved digging dirt every day or most days. Riverside County, again, is home to a lot of construction and manufacturing jobs and businesses as well. And then about 66% had stated that they've been exposed to a dust storm at work. We started to ask questions as well about their symptoms and their experiences. So about 60% of the participants reported experiencing symptoms. About 90% of this was reported fatigue, 86% reported difficulty breathing, 86% reported coughing, and 78% reported fever. 68% of the participants were also reportedly diagnosed with something else before they were tested for valley fever. We saw that some participants reported delays in diagnosis. So they had the symptoms that had started, and then their first healthcare visit was about 10.5 days after that. And then the median time between seeking healthcare and then being tested for valley fever was 28 days. And the median time between symptoms first starting and then having a valley fever test was 44 days. The most common place that patients reported seeking healthcare was the emergency room initially, and then with a primary care physician. And then we had 39% of patients who tested positive, who tested for valley fever in the emergency room, and about 22% were tested by a pulmonologist. 70% of the participants were given medication before being tested for valley fever. This is where we get into most of the antibiotics. We also had a larger percent that were given steroids and a larger percent that was given something else, and about 1% that were given antivirals. And then we saw too that about 60% of our participants were hospitalized because of their illness, and about 15% of these were in the ICU. Once they were either properly diagnosed or had sought care a second or third time, 47% of the participants were given antifungals. 40% of the participants had not been told about their positive test before they were called, and 30% had not fully recovered. So these preliminary results highlighted two of the major themes for us. Participants often experience delayed diagnosis, and then we saw some inappropriate use of antibiotics that was contributing to some of the antimicrobial resistance. And then we are hoping that educating, the community members and some of our providers as well about the symptoms and treatment can improve some of these health outcomes. And we can help out our, friends like John, who waited a pretty long time to get a test for valley fever and became incredibly sick. So, thinking about what could have happened if he had been tested in his first healthcare visit rather than having to wait a bit and progress in his illness. And just a big shout out and thank you to our survey participants. Again, it was a pretty lengthy survey, but a lot of the participants were really willing to chat and share their experience because some was out of frustration, some was out of just being confused. And then just another thank you to the Riverside County Department of Public Health and also the California Department of Public Health for their assistance with the survey and administering it and everything. So thank you.
Thank you so much. Great presentation. Any question?
Yeah, great presentation. Did the 50, I think you said 53% of the total number that you tried to contact responded. Was that 53% of the ones that you actually were able to get a hold of, or was that 53% of all of the people who you attempted to respond to, contact? 53%
of those that tested positive. So we called our whole sample of 400.
Yeah, so the non-responding group, that includes people you couldn't get a hold of.
Yeah.
Yeah, because Clarice Tang's study at Arizona Department of Health Service, of the ones that they actually could get a hold of, their turn down rate was like less than 5%. And I don't know if that was your experience too, that if you got a hold of them in that survey, everyone wanted to say
Yeah.
what they'd been through.
Yeah, yeah. And that's what we were kind of amazed by, that those that were, they were actually willing to chat for a bit. And, 53% for, I think, a pretty lengthy survey. I don't know if I would answer a call, to be honest, was really surprising. So yeah, I think people are really interested in it. And it's just nice to see what the community is feeling and everything.
I think you said 60% of people had symptoms. Is that right?
They were asymptomatic.
So I'm wondering why they were tested.
Excuse me, the 60% are asymptomatic in general.
No.
And those that had, we had 60% that did experience symptoms.
Yeah, what I'm asking is the 40%. Why were they tested?
So they had either gone in for another reason, or they, like when we had one individual, for example, that they had bronchitis. So that was similar symptoms, but they knew it wasn't, I lost my train of thought, I'm sorry.
It's okay. I'm just curious. You might not know the answer. That's okay.
No, it's a really good question. So there were a number of reasons that they were tested. It was either, we had a few that were exposed or believed that they might have been exposed and were told to follow up. Those were a small sample of people that worked at a similar office building, where 2 individuals had tested positive. So they didn't have any symptoms, but they were told to go in. That was probably about like 6 individuals. It's not the 40%, but that was one of the reasons. And yeah, it's just, I think some places do more routine ones when they know that there could potentially be something. Either they saw like in the chest x-ray for another reason also. Those were the ones I can remember off the top of my head. Yeah,
Thank you.
Is there time? Okay. Similar about this, I was surprised by how many people were digging in the dirt. Can you go back to those numbers?
Yeah.
Is it of the people who were employed, there was a certain number that worked outdoors? So is the 52% of the 36%, or of, like, so half the people had jobs involved digging dirt?
Yes.
Was that of the people who were employed who worked outside?
Yes.
Does that make sense?
Yes.
Okay, because I had a hard time measuring that with how many were retired.
Yes.
But it was 52%.
Apologies for that. Yeah.
Okay.
So
Okay.
50% of the 36.
So 15-ish percent
Yeah.
were having dirt. It still seems like a lot. That's
Yeah,
interesting.
it's as I was kind of mentioning too, like it's a really growing area. Homes are very affordable in Riverside County as opposed to a lot of the Southern California region. So there's been an influx in workers that are outdoor in construction, especially our men. Yeah, thank you for asking. Yeah.
So I believe, but I might be lying because I was involved with this some years ago, that in California, it's a law that if you're doing this, you have to be informed about the risk of cocci and instructed about it by your employer, or they're not in compliance with workers' compensation.
Yeah. Yeah. It is.
There's selection bias here.
Yeah. Yeah.
I was wondering if you care to comment about what seemed to be a rather relatively high number of people that did not know their test results.
Yes.
That was what, 60%, I think you said?
Yeah, there is a high number of individuals that tested positive and did not know. And that was a little bit of a challenge when we first started doing these calls, because their initial, not diagnosis, but their initial letting them know that they had it was coming from it was not coming from their physician, it was coming from like a communicable disease specialist. So that we were very careful with the way that we were phrasing how we were letting them know, like, you had tested positive at some point. Can we answer any questions about it? But we do recommend following up. But there is a very big delay, and that is a big gap in why we wanted to do this study as well. That not a lot of the hospitals that in Riverside County specifically are following up with their patients when they are tested positive. And a lot of times too, the test is sent to multiple labs, and then by the time it comes back, and then it's either they think it's already past the date that they may have the symptoms, that they're like, okay, we may not need to follow up. So it's there's a lot of gaps in it, which is unfortunate. but something that we hope to continue to address as we continue this project. Yeah, thank you.
Great talk. If there's any other question, please connect outside.